and welcome to today's webinar on increasing childhood immunizations for school-aged children. I hope you are doing well. My name is Shamika Davis, and I'm a program manager at the School-Based Health Alliance. The School-Based Health Alliance is a DC-based nonprofit founded in 1995 and serves as the national voice for school-based healthcare. Our focus includes policy, standards, data, and training to support and grow school-based healthcare, particularly school-based health centers. We believe that all children and adolescents deserve to thrive, but too many struggle because they lack equitable access to healthcare services. School-based healthcare is one solution, bringing healthcare to where students typically spend the majority of their time in school. When schools, families, students, and the community work together, students win. I would like to share a few reminders for today's webinar. All attendees are in listen-only mode. To ask a question during the webinar, please use the chat function on the bottom of your Zoom control panel. Closed captioning is enabled for this webinar. To turn it on, please click the CC button on your Zoom control panel. At the end of the webinar, we invite you to complete an evaluation. Your responses are important for helping us to understand how to improve our work. I would also like to share that a copy of today's presentation slides and recording will be available in the upcoming days. I am happy to introduce our presenter for today, Tammy Greenwell. Tammy Greenwell is the Chief Operations Officer at Blue Ridge Health. I now welcome Tammy.
Thank you, Shamika. Happy to be here with everyone today. She mentioned I am Tammy Greenwell. I'm the Chief Operations Officer at Blue Ridge Health. We are located in Western North Carolina. We provide comprehensive services, pediatric services, as well as family medicine. We have a residency program, and we also have over 30 school-based health centers in North Carolina. Next slide. So today, hopefully, as you guys spend some time with me, we're going to identify some strategies to increase your ability to increase immunizations for school-age children. We'll talk about some barriers to care and how to mitigate those issues. And hopefully by the end, you'll be able to choose a couple of these strategies that you can implement immediately in your health centers, in the workflows in particular, to increase those immunizations for school-age children. So the first thing we have is a poll question, and the lovely ladies at SBHA are going to launch that poll for me, but just want to figure out who's in the room today. So I'm going to let them take over. If you guys would answer that question, and you can answer multiple choice. Just want to get kind of a little bit of a gauge on who's in the room and what you guys are doing in your health centers. Okay, hopefully everybody's had a chance to take the poll. Can we see what those results are?
Yes, currently we have 33% federally qualified health center with primary care, 33% federally qualified with pediatrics, 44% of our audience is federally qualified health centers with school-based health services, and 44% all of the above.
Okay. Awesome. Thank you, guys. It's just good to know where people are in that in kind of the scope and the breadth of services that are being provided. Next slide. So strategies to increase immunization. So what we're going to talk about today, or how I've kind of divided up the webinar, is around communication, outreach, operational strategies, and partnerships. And you'll notice in communication and outreach, several things overlap because some of those things go together. But hopefully you'll see some of these strategies. Maybe you've tried some of these, maybe you haven't. Maybe it'll spark some creative energy for your health center. Next slide. So this is just to give you a visual of where Blue Ridge Health is in North Carolina. As I mentioned, we're in the western part of the state. We have school-based health services. As I mentioned, we have over 30 school-based health center sites. We do provide immunizations at those locations. We also have pediatrics practices, including specialty pediatrics, things like pediatric neurology, pediatric endocrinology, and pediatric nephrology. So those are new additions to our ped specialty. We also do pediatric psychiatry work. So lots of work around pediatrics in a lot of different locations. And then we have family medicine at all of our locations, and you'll see the different counties that we serve at this point as well. Next slide. Communication strategies will be the first area I want to kind of dive into. And paperwork, while it seems very simple, can be very complicated, and it depends on what that paperwork looks like. So do you give it in all options for registration online? Can someone fill it out on paper? Can you text them a link that they can complete registration? So making it as easy as possible around getting the paperwork that is needed to complete immunizations on children. And then doing your homework. One of the things we found is that we want to have lists of children who need those immunizations compiled during the summer months. So a lot of our school-based nurses, most of our schools are on a traditional school schedule. They're not open in the summer. One of the first things they do as they're kind of wrapping up school is they start making lists of kids that need well child checks, lists of kids that need immunizations, and particularly looking at those transitional ages like grade 5 to 6 when folks are going to need some more childhood immunizations that maybe they didn't receive earlier on. And then also middle school, high school, but really working through all of that. So, really getting a concise and clear picture about which kids need which immunizations, which counties those are in, how do we make sure that we give access to those locations to make sure we're able to give state vaccine or private vaccine, and we have all the immunizations that are needed there. So again, creating those lists, making sure we have that accurate information, giving all those options for registration, whether that's online, paper, text, and then adding that information and paperwork to school websites. Since we are talking about school-age children, they're obviously enrolled in some sort of school unless they're being homeschooled. And so working with those schools in your districts where you have clinics, where you have services, to make sure that you're linking that information to those school websites. And because parents a lot of times go there before they go to your website. So really firming up that connectivity with the school and being able to host that paperwork and information. And then asking about medical home and primary care medical homes on school registration paperwork, work with the school to offer immunizations. What we have found in our experience with both school-based health and our pediatrics office, and kind of those two working together to create a safety net in the communities we serve, is that there's no wrong door. So they can show up at the pediatrics office or they can show up at the school. We're going to make sure that they get that immunization that they need. And then certainly, working with their medical home or their PCP, if that happens not to be your health center, to make sure kids are getting those immunizations is another important piece. Not just that you're giving them, but that they have access to that and they're receiving those. Next slide. Another communication strategy around events and technology. I'm sure many of you have been to open houses that schools have had. maybe parent teacher organization meetings, sports events. As I mentioned before, what we say is there's no wrong door. So, how do we effectively work within our communities and with those agencies to come up with, something that hasn't happened before, or a point of connection with parents and guardians and others to make sure that we're, you know, making sure the kids have had those immunizations, or at least they have access to it. So, an example would be sports events. Certainly, I know those aren't going on right now in most schools, although some of you may have year-round schools, and so there may still be sporting events and things happening. But working with the school to, set up an area that is right as people come in the front, or it's near the concession stand, where you're able to give that information and really make that connection with parents and guardians, to get those immunizations scheduled, whether that be at the school-based health center, at your clinic, a mobile event. Those sorts of things is really important. Maybe not necessarily going to give, immunizations at a sporting event, but any opportunity to kind of connect with parents and guardians is an important piece of this. Certainly using school alerts and notification systems. I'm not sure if you're like me, but I still get those in the summer. I just got one last night about food, for any families that need food in the summer. So certainly working with the schools and the administration to have those school alerts go out about immunizations. Maybe potentially you're having an immunization clinic or an event in the community during the summer, and you want to make sure all the schools in your district are aware of that. The school alert system and notification system is a great way to reach those folks who may be in need of that immunization check. Using your own social media or your electronic health records. So social media, I think a lot of folks are connected to LinkedIn. You might be connected to X, Facebook, all of those social media outlets, Instagram. If you're having an event, make sure you blast it out to all of those locations to make sure people are aware of, the immunization clinic, or if there's, hey, come in and the next time you're at your doctor's office, a reminder, let's make sure that your child has all of their immunizations. Electronic health record blasts. So some electronic health records give you the ability to send out communication. That communication can come in different formats and in different ways, but using your EHR to really hone in and figure out which kids, which ages you're going to send those blasts out, making sure that you also have the capacity at your office. If you say, call our office for an appointment, or, learn more about immunizations here, that you have that person connecting on the other end to make sure that you're able to answer questions and get people scheduled. Community events during the summer. Certainly there are lots, at least in the communities that we serve, there seem to be a lot more events in the summer. People are out and about. We have an apple festival. We have lots of different festivals going on. So being at those community events during the summer, just really being out there, in the community, making sure people understand about immunizations, what's needed, and how you can help them, be get access to those immunizations as well. And then back to school events, that's always a very popular time. Since we do school-based health, we have 30 different sites. Many of the agencies and schools that we work with do a back to school event, and that's around backpacks and school supplies and all of those things. So, making sure that you're at those events, that you're able to also talk about how you can increase those immunization rates and connect with folks at that level, is also a really important piece of the puzzle. Many people have kindergarten readiness rallies. That's another great place to connect. I think most of those are in the spring. So maybe you don't get to do it this year, but next year, making sure that you're part of those events or figure out what's happening or even organize one of those events so that you can be out there providing that message and that access to students. And then mobile events, if you have a mobile unit, and if you're like us, we have several mobile units. And so let's not have them sitting there in the summer months. Let's figure out how we can target different communities, different areas to provide, an event. Maybe it's a very rural community and there's not a lot of access. Talk with the schools, talk with different agencies in the community. Can we bring our mobile unit? And usually on the mobile unit, you can already have your immunizations queued up. So it ends up being a great way to both share information and communicate with others, but also potentially actually provide some of those immunizations. Next slide. So one communication strategy that I mentioned is around school notifications and school notification messaging. So I've done this myself. So working with administrators in different counties, coming up with a unique message. You don't want something that has so much information in it that it's going to take a long time. They generally want something that's a couple of sentences, something that can be easily texted out, that they can easily, speak. It doesn't have to be overly complicated. You don't have to use a lot of medical terms or, immunization terms. Just here's the message. We need to make sure kids are getting their immunizations. Please contact Blue Ridge Health. Here's the phone number. You can also access the school-based health center. So just an easy way for people to get connected as well. And then always, the request should be that the school sends the message separately from any regular school news, which normally they want to do anyway. They don't want it to be confused with the school. I know that, the Parental Bill of Rights and some other things that are out there now may make that a little complicated. So, making sure the school, doesn't feel like they can't do that because they're not a medical provider or, just kind of understanding that relationship. But it should be just fine. We've done it several times and it really works very well. So sending that message via all platforms, whether that's text or voicemail, people receive information in different ways, and certainly just using that alert system to reach a large swath of people is what you're trying to do in that process. And then add your staff to that school notification messaging so you can hear the message. I think sometimes we feel like it's really simple, or we've got a really good, message to send. But until you hear it, sometimes you're like, maybe next time we should add this, or we should change this piece of the messaging so that it's more clear next time to, families and guardians and others in the community, exactly how we can provide access and how that would work for their student or their child. Next slide. So have another poll question for you guys. What barriers has your organization faced in trying to increase immunization rates for school-age children? You can free text a response in there, and I'll give you just a minute to do that, and then we'll take a look at what some of those barriers are as we move forward. Those are things that we can talk about. I feel like we should have some music or something that plays while folks are answering this question. Okay, let's see what we've got.
Okay, let's see.
No responses?
We do, but they are not displaying. I'm sorry.
Oh, okay. Oh, too quick. Sorry, Suzanne. no shows, lack of transportation, parent communication, difficult to get parents to answer their phone calls, getting parental consent, calling patients with past dose vaccines and for physicals, lack of parent communication and follow through. Okay. Thank you guys. Sorry about that. Next slide. So definitely understand the no-shows, the lack of follow through from parents. So I think, part of the strategy is to make sure that, when you have those points of contact and you're working with parents, you're developing a relationship. So continue to develop that relationship. Sometimes it gets to the point of your child can't come back to school unless they have this immunization. So I know that that's very frustrating for schools. And so really creating that flexibility. So for example, in one of the counties where we have school-based health centers, the school will unhoused students. Okay. Thank you. Um, you know, when you have someone who needs to get an immunization and they're like, okay, fine, I'll do it right now, you want to be able to give that access. I know that's not always something that can happen at every health center, or every health center may not be set up to provide that access that quickly. But if you can do that, that has made a huge difference. One of the things we work very closely with school districts on is when they have a student who they're getting ready to say, they can't come back to school unless they have this immunization and they need to get it that day. We work very hard to get that student, that child, that immunization that day so that there is no lapse in school, or early the next morning, depending on, when this conversation is happening. Now, that has taken time. It has taken time building that relationship with the school districts along with the community to be able to provide access. But when it happens, and it happens frequently, you're creating a better safety net around, not only increasing immunizations, but making sure people are getting those required immunizations as well. So part of that, whole system, reducing that barrier, is creating that more immediate access if you have that capacity to do that. So that can be a challenge if if you don't have clinic providers who can do that, or you don't have clinic providers every day, or even if you don't have all of the immunizations that you need every day. So it's just one strategy. If you have that capacity or the ability to look at that, that may be something you want to expand upon in your school, in your community as well. Some additional strategies. We talked about communication. Now we're going to talk about outreach. A lot of these overlap because when you're doing outreach, you're communicating. So, of course, some of these are going to be a bit the same. So having events with schools or other community partners in the summer is really, it can be very fun. It's a great time for parents, guardians, children to engage with your teams in a different way. So being creative about those things. An example might be, hey, our school is doing a food distribution and they're going to hand out our immunization clinic flyers, or they're having an event during a local festival. We're going to be there with the school, helping promote, making sure that kids are getting their immunizations. And then we're going to have a mobile clinic in that spot, a week later, so people know to come back to that spot. Or if you have the capacity to have the mobile unit there, providing those services, as people are coming up and requesting information or requesting food or whatever that may be. Utilizing champions. So parents or faculty at schools who have used health center services is often a great way to also get the message out to people in the community about what you do around immunizations. So For example, in one of our communities, we have a principal who has used our services. He's actually primary care to our health center now, but loves our school-based health center. Uh, he will talk to anyone and everyone about the benefits of school-based health, about having immunizations on site, about, just the way that we approach providing those services to students and their families. So identifying those champions can be great. We also made a video that he is a part of. So, you know, that has been a great addition because this is a person who firsthand people in the community trust. They may not trust me, but they certainly trust this individual, this principal. And so if he says it's good, then maybe they'll try it, or maybe they'll be more open to working with us around things like immunizations. One of the other great things that we have put on our website, it wasn't an original idea of ours, but is what to expect during an immunization appointment. If you're giving immunizations at school-based health centers, that's a lot different than giving the immunization in your pediatrics office or your health center, where the guardian and parent are likely to be during the immunization appointment. If you're doing it at school-based health, you may be getting paperwork signed, having information, and then you're going to give the immunization on a specific date. The parent may choose to be there, or they may choose not to be there. So we found that it was more helpful also to help the kids understand what to expect during their immunization appointment. So we actually got some kids to do a video with us, kind of walking through that process of getting an immunization and what to expect and what's going to happen. So that has been a great addition to kind of social media, those sorts of things, to let people know what to expect and how that's going to look and how that may be different in a school-based health center versus in the pediatrics office as well. I already mentioned the school alert and notification system messaging. Again, it seems pretty simple. Some of you may have already done that, but it has been an effective tool for us to at least get folks communicating with us. I know one of the things in the comments section in the chat was, you can't get parents to follow up. You can't get them to call you back, or maybe you don't even have a good phone number to begin with. Schools generally have the best way to communicate with parents and guardians. So I think it's a great way to get your message out there about events or communications, anything that you want to talk about around immunizations. And then, as I mentioned, the back to school events or the backpack handout events, those have been really critical because, we're generally reaching those folks that are underinsured or uninsured, don't have resources, maybe have additional social determinants of health that need to be addressed. So having staff there, having immunizations available there. So it's like, hey, Timmy doesn't have his Tdap. He's got to have it to get back to school. Why don't we go ahead and take care of that today? Sometimes, doing it in that fashion is also very helpful because it's almost like I get my backpack, I get my back to school events, and I get my immunizations, and I'm ready to go back to school. So just thinking about, is that something that's a possibility for your organization to be a part of as well? Another idea is hosting a drive-in movie night in the community. And we'll talk about that in a minute. And then using your mobile unit for those hard to reach areas and communities. So certainly if you have a mobile unit, you want to get it out in the community. You want to make sure that you are meeting folks where they are. So if transportation is a social determinant that is too bad for a family, and maybe it's a concentrated community, I can tell you we certainly have pockets of communities within the counties and areas that we serve where transportation is a big issue. And so taking our mobile unit out, making sure we're providing that access, whether we're parked at a school, we're parked at a community site, we're parked at a hotel, wherever that may be. And, we just develop those relationships so that we can make sure we can get our unit out there where it's needed most. Next slide. So the drive-in movie night is something that has kind of transformed from another concept, which is called homework diners. So during the school year, homework diners occur, which is a time they usually happen once a week, once every 2 weeks. And families come in, they get a fresh meal, hot meal. Their kids get help with homework assignments. The school-based health center staff are there to provide well child checks, sports physicals, that sort of thing. So that was a concept that we just started within the last year. So then we're like, well, what do we do during, the summer or when school's not in session? So came up with a concept of a drive-in movie night. So have an opportunity for students, parents, guardians, health center staff to connect during off-school time. So what we've done is used a school campus, put up a screen, show a movie outside, have pizza, have snacks, have gift card drawings, different things like that to get people out to hear about services. And so what we talk about is we ask every participant, when's the last time you had a well child check? What about your immunizations? What about sports physicals, other visits? Even creating an evening schedule to book appointments in advance. So if you're having the event, you can take your mobile unit. You have the capacity to provide those on site. Go ahead and make those appointments ahead of time, realizing, yes, there may be some no-shows, but usually the movie, the pizza, the drawings, that is usually pretty enticing for some folks too, because it gives them something to do during the summer with their kids, and they're going to the school because that is where the schools the kids go most of the time. So it's easier to get them there. And then we also have a behavioral health counselor on site to meet and greet, just talk to folks, see what's happening, any needs, any services. It's a great time, like I said, for center staff to connect during off school times or off, clinic times. They're able to start developing those relationships with folks in the community. And then having your health center, or if you have different patient enrollment paperwork for your school-based health centers, having that ready to hand out. I mean, even getting some paperwork completed, getting people, registered for services. Maybe they don't want a well child check that day, but they want one 2 weeks from now, or, they're going to come to your immunization event right before school starts. Just getting those connectivity points, those relationships started is a great place to also do this as well. Next slide. So, poll question. We've talked about communication, we've talked about events, and now we're talking about operational strategies, or that's going to be the next thing we chat about. So what operational strategies have you used to try to increase school-aged immunizations that were successful? And I'll give a few more seconds of time. I'm sorry, I didn't mean to make everybody have to rush to answer questions. So give everybody a full minute this time to answer the question. Okay. Can we see what we've got, please? Again, I know you may need to put it in chat.
Yes. Yeah.
Okay. Thank you, guys. So creating a registry to assist with tracking and outreach, offer to set up a vaccine clinic at multiple schools during the summer. Incentives similar to what was expressed in your slides. Okay. Great. Thank you. Move on to the next slide. So operational strategies, you guys have touched on some of these already. But one of the things that we were finding, because we have so many pediatric patients, is that yes, we were creating registries. Yes, we were tracking. Yes, we were telling people you need to get this. But doing that at every visit, whether it's a sick visit, whether it's a well child visit, whatever that visit may be, incorporating that into your workflow so that's asked at every visit, whether it's the school-based health center, whether it's your pediatrics office, which does take a little bit more time for your staff to get prepped for that. So prepping those charts, but also the parents and guardians before the visits. What we found is that people don't always connect coming in for a well child visit with immunizations. They certainly do with very young children, but not always. And so, you start seeing those well child visits fall off, start seeing those immunization rates decline. So making sure that we're connecting with those parents and guardians, and we certainly have the same issues with parents or guardians not following up, not answering our call. What we found is that we will use our EHR system. We have a texting system called OMD as well, which allows people to text us back. And so that has been very useful around getting communication out to families, getting communication back. So just a different strategy to think about as well. Turning those sports physicals into well child checks. We certainly see that I think in most pediatrics offices, maybe not all, but generally they don't want to do a sports physical if a well child check is not being completed. So you'll do a well child check and then you can fill out the sports physical information. In the school-based health centers, sometimes we see more sports physicals than well child checks. So creating that strategy of, okay, so this kid is here in the school-based health center, they need a sports physical, but I need to stop for a minute, make sure, have they had a well child check? What's their immunization status look like? So again, prepping before the visit, making sure that you have all of that data and information, making sure the parent's fine with that becoming a well child visit without them being present if you're doing that in the school-based health center. So lots of pieces to that puzzle, but it can certainly help with making sure we're tracking those immunizations and we're getting that follow-up and getting them completed. One of the things I hear sometimes is that, well, we have private vaccines, but we're not a state vaccine provider. I would imagine most community health centers qualify to be that, depending on your state and what those requirements are. But one of the things I've heard too is like, oh, well, I showed up for the visit, but you guys didn't have the vaccine that I needed. So again, that prep work, making sure you've got the inventory, you've got what is needed, both if you're in a clinic site or if you're in a school-based health center site. So that vaccine management, making sure you have those present and available, even when you're doing your outreach events, making sure you have everything there so that if someone comes up, you can give that immunization right then. And then another strategy is connecting, if you're a school-based health center program, I'm not sure how well everyone does this, but connecting any of your unattached, uninsured patients to your health center during the summer to schedule immunization. So folks that may have used you for only an acute visit in the school-based health center, how are you communicating to them when school is letting out that, hey, you can go to our health center and our health center is located at this address. And by the way, Timmy needs to get his Tdap before he comes back to school next year. They can totally give that to you there. We'll probably have some events. So again, it's that communication, getting that information out. Another strategy that has worked well for our school-based health centers is to open the clinics about a week before school actually starts to provide immunizations. That way, if students are coming in, if they're meeting with folks, whether that be an orientation for students, Even an orientation for faculty, a lot of times we found that faculty, I mean, they generally have children too, but they may have children that are coming to that school or going to another school, and they're like, you know what? I need to get that immunization for my kid. And then utilizing those mobile units to provide events in more rural or hard to reach places, which we've kind of already talked about. Next slide. So mobile units, just wanted to talk a little bit about that. I'm not sure, that was not one of the questions I asked, but I'm not sure how many of you guys have mobile units or use them. I know a lot of people use them for dental, or they may have a mobile medical clinic. So just wanted to give you some information on that. As of July of last year, the National Association of Community Health Center, or NAC, showed that school-based healthcare is the #2 site for health center mobile units behind community events and preventative visits, and immunizations are the #1 and #2 services offered. So if you're not doing that right now on your mobile unit, can you do that? Can you add a fridge? Can you make sure that it meets all of your state's requirements to have vaccines? Can you create a workflow that will allow you to have immunizations on that mobile unit, whether you're doing medical or dental, whatever that may be? Just how do you make sure that you've got the services on there that folks need? And you can increase access in locations other than the schools, particularly in rural areas. So thinking about what I said, like, you could be at a hotel if the hotel gives you authorization to be on their property. Like, there's so many different ways to look at utilizing your mobile unit and the different areas and how you can cover those more rural or high need areas. And as I mentioned, it can also house additional equipment, whether that's dental, vision, um, any services that you're providing. If you're providing dental on that bus, you can get an immunization fridge on there and use that same thing, because I guarantee you, if a kid needs immunizations, they probably need dental care as well, because that's usually what we find, is that there's definitely a link between, not having that access to services, whether it be medical, dental, immunizations, whatever that may be. And then mobile units are great for branding and marketing. You can wrap your bus or your mobile unit. I would imagine most people do. And you can get, stick-ons, like they're just like magnets that stick on, and you can say immunization clinic, and you can just take it off when you're finished. So there's lots of things you can do if you do have a mobile unit as well, to kind of increase these strategies too. So next slide. So mobile units, of course, look at the importance of workflows. If you already have a mobile clinic, you probably already have gone through something like this. This is a pretty, this one is around TB. So hopefully you're not using your mobile unit to address TB, but just kind of talking through, like, what does that look like on a mobile unit? If you've got a new patient, if you've got an existing patient, what is that going to look like? What is that workflow? What screenings are going to happen? Who are the staff that are going to be on there? What does that look like? And how do you utilize it to the greatest capacity? And make sure that you're out there providing those services that folks need. Next slide. Some other strategies: evening hours, if you don't have evening hours, open during sporting events or other times. So just really taking a look at that from the perspective of working parents, from the perspective of others who need a different time. 8 to 5 Monday through Friday doesn't work for me. Okay, well, does Saturday work? Could we do a morning clinic where we do immunizations only? Or what does that look like? Or how do we work with others to make sure those needs are met? Working with the school nurse to schedule those that need immunizations. I'm sure a lot of you guys do that already, but developing that partnership and that relationship, a lot of that depends on who the school nurse is employed by. We're in 8 different districts, and some of them, the schools employ them, or the LEA, the local education agency. But in others, it's the health department or it's some other agency that the nurses work for. So working with them to schedule those that need immunizations. Creating standing orders, a default option during all visits, that immunizations are the top priority, and here are the standing orders. So if this is a need, here's the standing order. You can give the injection. Um, Financial incentives, we talked about that, whether that be, gift cards, uh, dinner, whatever that might be, what works best in your community, what is going to be, that financial incentive that's going to, entice someone or help them, make that commitment to getting those immunizations. And then how comfortable are your providers in explaining needed immunizations? There's a lot of vaccine resistance right now. That is very much so. But how comfortable is someone when they have a parent or a guardian in front of them saying, I'm not getting that, I'm not doing it? Like, what are their skills? And I think about motivational interviewing. So do your providers, have they had training on that? Do they understand what motivational interviewing is? Do they understand how to, talk with a parent and help them come to the conclusion that this is the best thing for your child and here's why? So there's lots of videos on that on YouTube. You can also do formalized training on motivational interviewing, but that's something that all of our providers have gone through as well, just to make sure, because sometimes you think, oh, they went to medical school, they're a doctor, or they went to school, surely they feel comfortable doing this. And that's not always the case. And it may not be the person who needs to be explaining the immunizations. It might be your immunization nurse. So just figuring out who that is. And then those vaccine ambassadors, like I mentioned before, I called them a champion. Like, who are those vaccine ambassadors in your clinics who, like I said, are that go-to person? And maybe they're the person that gets motivational interviewing training. Maybe they're the person that loves to increase immunizations. They're the ones who are your cheerleader for that. Creating those positions and giving that authority to someone can be very helpful in increasing your immunization rates as well. Next slide. Telehealth is another strategy that can be used for operational. So I think sometimes people don't think about utilizing a telehealth visit before actually providing the immunizations. So you could do a telehealth visit, get the history, parental concerns, even consent, prior to having an exam and immunizations done in person, whether you're doing that at the health center, the mobile unit, or the school. So again, being that flexibility, trying to figure out what is going to make the most sense in getting more people to comply with what is needed. Next slide. So we're going to take just a few seconds on this one, but what partnerships or collaborations do you guys currently engage in to offer immunizations to school-age children? And I'll give you just a minute because we are quickly approaching our time. Okay, can we see the results? We have some. Okay, next slide. So one of the things wanted to talk about are some partnership strategies. What are some other ways? Certainly schools, we've talked about that, but they can provide space and resources for your school-based health center site and services, training for school teams, building protocols together. You could build some protocols around immunization strategies, and then supporting the whole school community and child. The school nurses, as we just talked about as well, that is part of an operational strategy, but they could be employed by the school, the LEA, or the health department. So working closely with the school nurses to figure out which kids need to be targeted, which ones are due for immunizations, past due. How do we make sure that they get taken care of, whether the school nurse is giving the immunization or you're giving the immunization? We want to increase those immunization rates. And then collaborative agencies, someone already mentioned that they collaborate with other health centers and they have regional relationships. Those can be really important as well to create that safety net for immunizations and working within communities to make sure that if that child goes in this door at this agency or comes in our door, we're linked together. We're going to work together. We're going to make sure that they get the immunizations they need. Next slide. So associations. So you've got the School-Based Health Alliance, the National Association of Community Health Centers, the Primary Care Association, state primary care associations for FQHCs. Lots of resources and knowledge with each other. That's a great place to also partner, just across your state and thinking about strategies that you may have or things that may work if you're working in that bigger partnership. Funders. So lots of funders are very interested in childhood health. They want to make sure kids are healthy, safe, that they've got the immunizations and everything that they need. So looking at those sorts of strategies. And then I'll just mention briefly full service community schools partnerships. You'll go to the next slide, which really is about community schools. So again, integrating into the schools, really the four pillars of community schools, where school-based health, where immunizations, where health centers interact is around those integrated student supports, and really those health services through partnerships. So working with someone that is a full service community school, working with an agency that is part of that partnership is really a way to get resources, to also get additional access to families and to students, and really addressing those social determinants of health, because certainly they need immunizations and we want to increase those immunizations. But if they're too hungry to think about getting immunizations, we need to also address that issue along with making sure they get the immunizations they need as well. So it's a great partnership strategy if you know of full service community schools in your district, or if you don't, there are lots of those across the United States. They are usually funded by Department of Education and work in conjunction with several community agencies to create this full service community school scope. Next slide. Okay. I feel like I probably rushed a little bit there at the end, but does anybody have any questions? I know there were a couple in the chat. Yes, I can send the link for what to expect during immunization appointments. I'll make sure that that is part of the follow-up with the slides and information. And do our mobile clinics park and service multiple schools each week, or just on an event basis? They do service multiple schools. However, we also have a lot of school-based health centers that are located on school campuses. And the schools also have provided access for students from other schools to come on the school campus. So if you can imagine one of the school, for lack of a better word, trailer or modular units, and maybe it's not directly in the school, but students from that school can easily access it. But it also has a drive-up parking space that other students, parents, whomever can drive up and also go into the school-based health center as well. Those are some strategies that we worked on, making sure that, we're able to provide that access. We do all of that around school security and what the school feels most comfortable with and how they want to approach that. But yes, we do offer both of those. And I'm happy you'll get my contact information if anybody wants to reach out to me afterward to talk about specific things that we've done, specific strategies we have tried as well. Sometimes it's just helpful to talk through things. I'm happy to do that with anyone if they want to reach out to me after the webinar.
Yes. Thank you, Tammy. And we also had a question from registration. The
Okay.
question is, as a 2-year-old school-based health center, we are ramping up to offer vaccines in 1 year. What unexpected barriers might we face, and what are some ways to overcome and prepare?
Sure. So of course, depending on your state, they're very specific about which refrigerator they want you to have, which thermometer, temperature gauges they want you to have. So making sure you're in compliance with that. And then I think looking at the population that you're serving. So if you're in an elementary school, you're going to need, more vaccines than you would if you were in a middle school. So figuring out what are the vaccinations, what are the immunizations you want to have on hand. Um, and then also, again, based on those ages, you know, you don't want to have to waste vaccine either. So how do and they usually come in, they don't come as one, they come in multiple. So, kind of figuring out how you're going to do that vaccine management is going to be a big piece of that. And then I think the other piece is consent. Certainly, you can wrap that consent into your initial paperwork, but most places, including us, do not do that. We have a registration and permission, um, you know, consent for treatment, all of those things at the beginning. But when it comes to vaccines, if we're administering vaccines, we have a separate consent form, and the parent has to sign on each line for each immunization that they would like. So really figuring out your workflows for that process, and making sure that the school and the staff know that there is availability for that, because a lot of times they'll pop in and get their flu shot, or they'll get any sort of immunization maybe they're missing. So it's just a great way to market your services, but also those are the pitfalls that we have seen as we've started, as we started providing immunizations. It was the equipment, the vaccine management, and the consent forms.
Yes. Thank you, Tammy.
Yeah.
And thank you again for a wonderful presentation. And thank you all for joining us today. And as Tammy mentioned, you will be welcome to be in contact with us following today's webinar with any questions that you have from today's webinar session. So I just want to share an announcement that the 2024 National School-Based Healthcare Conference will take place June 30th through July 2nd in Washington, D.C. Registration for the conference is now open. You are welcome to visit the School-Based Health Alliance website for more information and to register, as well as scanning the QR code. We invite you to stay connected with the School-Based Health Alliance. We do have a School-Based Health Alliance digest that is available, and you are welcome to sign up on our website, as well as connect with us on the social media platforms. Again, thank you, Tammy Greenwell, for a wonderful presentation today. It is truly appreciated. Thank you all for attending today's webinar. At this time, we ask that you please complete an evaluation for today's webinar. And also in the upcoming days, you will receive a copy of the presentation slides, as well as a copy of the recording. If you have any questions in the meantime, please feel free to contact us at info@sbhforall.org. Again, thank you and have a wonderful rest of your day. Take care.